let me make it very specific to what really is happening to companies in terms of customer engagement. I think more importantly, what is happening is the acceleration of using technology at the front end was something that pharmaceutical industry was always a laggard, and compared to many other industries. While as much as the pharmaceutical industry was probably the leader at the back end and at the R&D, I don't think any industry was as advanced as them there. But on the front end, they were laggards. So that itself, that leap of faith to move on has happened. So that's probably the first thing. Second is, normally behavioral changes in organizations happen through behavior models. And the belief at the senior levels have gone up that this is something that we need to adopt in terms of technology adoption has to be at the forefront. And therefore it is sinking in better throughout the organization. Thirdly, probably the definition of customer. I think for us, probably the only way we used to deal with this industry was the industry speaks to the doctor, and that's it. This probable situation has enabled us to understand that the ecosystem doesn't stop there. And we cannot just, the ability to make a difference by share of voice is over. And the ability to create more share of mind compared to share of voice clearly is now possible if you use mediums properly. And why I don't say it's a digital strategy is because digital again is a medium, and we should not confuse it to be a strategy. Right. Ultimately, your strategy is what it is. You're using a particular medium to achieve your strategy. So that interface that digital allows you to make it better is an understanding that is coming through.
At the end of January, actually early of the February, we start to see the online doctor behavior become a change, especially at the beginning of the February. So everybody knows that WeChat is a quite important channel for the digital to engage the customer. At the beginning, we find out the behavior for the doctor to learn the academic content. Actually, the peak time is 7 p.m. at night, which is we can easily understand. So when the doctor return from home and return from work back to the home, and after dinner they start to search for some of the content they could learn by themselves. But during the pandemic, we observed the peak time actually moved to 7 p.m. around the afternoon. So we after the reality check, we understand actually at that time the hospital traffic has reduced significantly during the daytime. And in the morning, definitely there were a lot of hospital activity to do. But a doctor are more moved to the afternoon during the work time. They start to learn and understand the situation. So that lead our digital daily publishing time from night to the afternoon. So which is can better use of the doctor time.
Setting up the digital ecosystem begins with the recognition that each of these customers have a unique set of needs and aspirations, right? And they are desperately looking for information through through their channels of preference, right? To treat the patient that is at hand. And building the digital ecosystem involves building a vision, a strategy, an operating model, the right infrastructure, and culture. These are the 5 buzzwords, right? So it starts at the top with the creation and communication of a compelling vision to establish a unique and differentiated experience that brings value add and satisfaction to each customer out there. To inform the strategy, clearly one has to understand the customer and patient journey, as you mentioned, and one has to do that very well. The traditional strategic approaches of segmentation targeting may not be very helpful, because one must be bold enough to embrace the concept of micro-segmentation and micro-targeting, right? We're talking about many shades of segments of customers now. The ways of working together must be redefined to establish an operating model that enables cross-functional teamwork and partnership with other companies to enhance the understanding of the customer needs. And finally, from an infrastructure point of view, it is important to build a universal database within the organization that's able to store and connect cross-functional digitized data and adopt then tools to analyze this data to generate insights and predict behaviors of the customers, right? And finally, culture plays a key role, as it can eat strategy for breakfast, right? So we can all come up with nice strategies, but if you don't have the right culture in place, God forbid, what might happen? In my view, there are three key enablers of digital ecosystem to support personalized customer experience. At the bottom, it's the data layer, data management. The second layer is the analytics and the insights generation capability. And the top layer is building a unique customer experience, and it starts with the mindset, the customer-focused mindset.
When I look internally, in the majority of our markets, to really think about that office orchestrated model first. Well, at the same time, in reality, I believe that several markets already before COVID-19 experienced similar challenges when it comes to field resourcing or customer access. And just to close off, I think that last but not least, thinking customer first, and I think that's also something really that Anand already outlined before, I think is really important, because what we're observing across markets and therapeutic areas, a really steadily growing base of our customers prefer this more office orchestrated model first. And it's the customer telling us where and how and when they want to have the field force to come in or not.
We help clients with these digital transformation journeys. Many of these have been attempted, but if we look at the research, and we did a very recent research across, I think, more than 200 companies, almost only 20 to 30% of those digital transformations succeed. And that is where I come to the question of your roadmap. And what was our finding on the ingredients of either success or failure? And we found that there were at least 6 common factors which made the difference between a digital transformation being a failure or a success. And Anand, Sanjeev, different people, referred to many of those, but let me just recap it, to bring it together. I think the first one is a very bold vision. Anand referred to it. Are you clear about what you're trying to do? Is your strategy clear? But also supporting your strategy with very specific outcome goals. Is my outcome goal that I really want to deliver my messages or the sales and marketing that I was doing previously in a very personalized way? Is that the specific outcome? Is my specific outcome that I really want to fundamentally make a difference to the patient outcomes? For example, if I'm operating in diabetes, which has always been the holy grail of trying to say that can I adopt a disease management approach than an episodic approach? So first of all is a clear, bold vision supported by specific outcomes on what am I trying to achieve. Second is leadership commitment. While a lot of companies have followed, the approach of 1,000 flowers bloom, a little experiment is going here, a little experiment is going there, but is it now supported with, absolute leadership commitment to this change? Because this journey is not easy. This journey is not easy to sustain. It is perhaps easy to start, but it is not easy to sustain. So that's the second part. The third, which Anand referred to, is a very robust technology architecture, which is modular, scalable, and allows for analytics. So, is your technology architecture which you're setting up, is it fully modular? Does it utilize some of the new ways of working in terms of APIs, microservices? The fourth, really, and which is the most important one, perhaps, is the human part of this. So we now use a concept, within BCG when we support clients, is what we say is that you are about to undertake a bionic journey. It is not a digital journey. It is how technology can blend in very well with the human capabilities. And the model that you're transforming to is therefore bionic, which is a word which refers to saying that there is a seamless flow of concepts from engineering to biology. And we've used that analogy to say that the success only comes when technology very well blends with what the human capabilities we have, and how we can migrate it to that. The fifth one is ways of working, and Anant referred to it as well in the way he talked about culture. So is it fundamentally changing the ways of working? And then the other one that we obviously talk about is a huge amount of reskilling, and the agile ways of working. But the interesting thing is not that these 6 factors need to be in place. Maybe all of us have referred to it in many different ways, but what the research points to is saying that getting 1 or 2 of these factors right doesn't move the needle. When you get all 6 of these factors right is when you improve the odds of success from 20 to 30% to 80%. It is that significant. And therefore, the roadmap is about making a very deliberate commitment, and it requires both leadership commitment and investment to get all these 6 factors right.